Welcome to Big D Energy.
There's a lot of Big D energy.
Today, I have with me, my partner, Mia, my partner in life, my partner in business, my fiance.
Yeah.
All the things.
Sorry, I'll try to stop rattling my crystals around.
Do you want to introduce yourself? Tell the people who you are, what you do. It changes like on a daily basis, so.
Yeah, I do pretty much anything and everything.
So I don't know how to introduce you other than as
I'm retired.
That.
A retired speech language pathologist. I am. I no longer work in that field. I am an oracle. What that means is open to interpretation and changes even for me a lot of times. I see the world as an energetic space, and I operate in an energetic way in this energetic space. So I see a lot of things that are unseen. I hear a lot of things that are unsaid. I feel a lot of things that people wish I wouldn't. And I use all of the modalities available to me at all times to heal people in whatever way they may need to be healed.
So before we get into that, why? So you're retired. Can't even say that. You're retired from mainstream world of medicine.
Yes.
How do you feel about the mainstream world of medicine? How did you feel about it then? How do you feel about it now?
I have always felt like an anomaly, like my whole life. But I especially felt like an anomaly in the world of Western medicine. When I was a speech language pathologist, I worked in schools, and I worked in long-term care settings, and I also worked in hospitals for a brief minute, right at the end there, quick burst.
Before the old COVID vaccine mandate happened here in New York State.
Yeah, that was the final straw for me.
That's what really led you into retirement. Gosh, that was almost 2 years ago now.
Exactly.
Time flies when you're having fun.
We were on vacation when we found out they were going to mandate it.
And this one said, fuck no. And I said, well, I've already got a few in my body, so what's a few more, you know? Take one for the fam. For the team.
I'm not against all vaccines. As a disclaimer. Our child is completely vaccinated. I am against...
Except for COVID. He's not vaccinated for that.
Yeah, well, that's dumb.
Or the flu.
I am not against...
about the inability of that to actually work.
Or I am not... What I am against is people not having choices about their bodies and what happens to them.
So is that why
firmly
you left
against
mainstream medicine? Or were there other reasons?
I mean, I was unhappy and I wanted to leave mainstream medicine for a very long time. I operate energetically. Like, I feel things and I hear things and I know things. I read people's minds. I read people's energy. I can't help but to use those skills in how I interact with the world around me. And so the way in which I interact with patients is very intuitive. The way I treat patients and the way, the way I treat patients or heal patients or work with patients is very intuitive. And that's not what necessarily welcome. it's not really very easily like understood or explained to the majority, and insurance companies want you to bill for like a certain set of things, and those are the only things that you're supposed
And
to
energy
do.
healing isn't included as an SLP.
Right. And not that, and even at the time, it wasn't that I was trying to use energy healing in my sessions. It was just that I intuitively knew like what exercises to do or how to work with a certain patient.
Right.
Or like specifically in dementia, where verbal language, or with stroke patients where verbal language is really, really, really inhibited. I don't necessarily need that to communicate. However, there's no standardized test score that you can get from being psychically in tune with your patients. And so it's pretty tough to operate in that way within the system. So I really, what it boiled down to is me feeling like shit about myself a lot. Because I really wanted to help people. And because I really did know, like I could discern between a cognitive impairment and a language impairment. So, like, is your brain not working correctly and you don't understand this? Or are you just unable to communicate what you do know effectively? And, like, that, for me, is a very intuitive discernment. Sure, I would administer the standardized test, but I would watch the person and listen to their answers, and like there were certain things, certain ways that they would respond, or certain ways that they would interact with me that would let me know where the breakdown was happening.
Right.
But instead of being like, oh my god, I'm a psychic, I was like, what the fuck is wrong with me?
Right.
Why don't I want to just do fucking articulation cards with babies or some standardized whatever?
Well, I mean, that's one of the things that, like, we talk about all the time, or that I talk to you about all the time, is that, yeah, it's really hot, is that, like, as...
This conversation is leading us in a very interesting direction.
Yeah, I told you it would. Like, as medical providers, right, like, we're taught to practice by, like, what a textbook teaches us, or what somebody who came before us knows and has learned from trial and error or whatever. And there's no room for intuitive feeling at all. And if there is, and you fuck up because of that, like, what do you have to back up? Oh, my gut told me I should do this? Like, no.
Right.
You better have, like, 6 textbooks and 17 up-to-date articles and, like, someone in the legal field backing you up.
Because the whole thing is, like, placed on this blame.
Right, but I practiced I got to a point towards the end of when I was practicing in a facility. Like, I got to a point where I was practicing very intuitively. I mean, of course, like, my intuition was being led by what I already knew worked or didn't work, but I used my own past experiences to know, like, well, this didn't work before when I tried this, regardless of if the textbook says this is the first thing you do.
Right.
No, thank you. But also, like, because, like, these are all individual humans who are all created completely differently. So, like, the textbook step-by-step algorithm isn't always going to get you the same outcome, because, oh, believe it or not, none of us are created equally.
Right.
Or the same.
Because I think that's the piece, though, that, like, because obviously, like, when you're in it, you're in it. So, like, I was like, clearly something's wrong with me. I'm not evidence-based enough, or, like, I should have a study to back up every sentence that comes out of my mouth, or, like, I don't know, it was this thing that was, like, this fear that was instilled in me in grad school. But at the same time, like, when the textbook approach doesn't work, when you're trying to do communication language therapy with someone who's had a stroke, there's multiple different, like, ideologies, theories, whatever you can pull from, ways to treat that language impairment based on how it presents. They don't all work. Sometimes you try something that's an established protocol with studies that show it works for some people, and you try it with someone and it doesn't work with them, and you're like, oh, must be not one of these people, and then you go on to the next one.
Right.
And that's accepted standard of practice. However, doing that on your own, or if you're using your own gut instinct or whatever, not a number, not a standardized test score to get you to that point, then you're wrong. Like, it's okay for all of these things to not work for every person. But then like, the flip side of that doesn't really make sense is, okay, so if her theory was wrong over there just because she's done 7 studies on it before, my theory didn't work either, but oh well, why can't we just go on to the next one? You know what I mean? Like, why is there like this blame, or what's wrong with you for trying to innovate? Like, you're supposed to be stuck within these things that have been supposedly proven, but all they have been is at least with therapy. Let me speak specifically to therapeutic interventions. Like, they've been studied and they've been proven to work for some people. Like, that's it. Like, that's the extent of the claim that it can be given. It doesn't work for everyone. But I think that really, like, this framework, right? Like, we are not a standardized population. You cannot standardize a population.
Right.
I think the standardization of humans is a huge problem. Probably the largest driving force behind the medical system that currently operates the way it operates. Because, like, chronic illness everywhere, everybody has it, because we're all being treated the same way for the same shit, when the same symptom can present in 2 different people and it can have 2 completely separate root issues. But we're all trying to treat everybody like the same person, and we're trying to make it all standardized and make a protocol and make a list so that no errors will be made, because humans will not have to think about it. They'll just follow the checklist, the little thought map. This question, yes or no, follow this line here. Yes or no, follow this line here. Yes or no.
I mean, and there's so many different directions you can go with that, too, because, like, if you look at, like, standardized treatment for something like heart failure, right? There's, like, this laundry list of meds that you should get put on the second, like, you're diagnosed with heart failure to preserve your heart function right out of the gate.
Heart failure.
You know, but there's, like, that's, like, with a lot of, like, different, there's, like, all of these, which has all been guided, like, which is, like, these core measures, which is why when you're, like, God bless you all, a family medicine provider, which is, like, you have 10 seconds to see your patient, and then you're like, oh, by the way, we just diagnosed you with something new, now we have to give you all of this stuff, but I don't have time to tell you about it, because gotta go on to the next one. But, like, it's really interesting, like, as you were talking about, like, the standardization of testing that we use on patients. So, like, cognitive testing, we were just talking about, like, that with dementia stuff. But, like, in the same setting that I worked in, had 2 very different opinions that I was taught based on who was in charge at the time. One was, this is the test, if this is the test score, this is where they're at, and that's that. There's no interpretation. You're not left up to any sort of interpretation.
Which is insane.
It's as if they're below a certain score, they cannot make their own decisions, period, end of story. Not like they just might not score well on a test, but they know everything they need to know in order to say whether or not they want to be a DNR.
Like, that's the thing. Like, we say these tests are standardized, but there's so many factors that aren't standardized. The room that you're in, the temperature of the room, the lighting in the room, if you ate recently, if you didn't eat recently, the person giving it to you, are they an asshole? Do they give a shit?
If you're
did they
eat because you just arrived from your 6-hour travel to your new facility.
Right. Is it Friday
Right.
at 4 p.m. and the social worker wants their fucking shots after work and gives two fucks about giving your cognitive test? Which, why is a social worker giving a cognitive test anyway? I personally don't know. I digress.
But, like, welcome to my life. But, like, but then there's the flip side of that, too. Which was then, yes, there's a test score. I'm aware of what that test score is. But I'm also going to walk my ass into that room and have a conversation with this patient because, believe it or not, they're a human. And ask them some questions. And so I can understand whether or not they could actually make this decision for themselves. Do you understand what the ramifications are of being a DNR or not? If I think you understand it, regardless of if your test score was an 8 or a 14, I don't care.
And also, like...
So, like, that's where, like, that intuitive guidance allows you to, like, right, to think, because... like, which is, I believe, appropriate. I think at one point I thought that was crazy because I was like, no, there's a number, we should just follow it.
Oh, for sure.
Now, I have a whole different viewpoint.
I was batshit crazy when I first started coming in your office.
Where it's like, oh, that does kind of make sense. That, like, just because they may not understand... I don't know, something crazy or remember what was said to them at the beginning of a test and not the end, like, doesn't mean that they can't understand what they want done at the end of their life.
Right. Like, this is also the thing. I'm sure you could pull up studies on this, but cognition is not cognition is not cognition is not cognition. Like, we're not just all comparing apples to apples here. I personally do not know what the date is today, and I only know what day of the week it is because you told me earlier.
And
I'm retired.
I've gotten to the point where I don't even know.
Right, because we're
what
retired.
Day of the week it is.
We're retired entrepreneurs. But that doesn't mean that I'm not cognitively intact.
Right.
And also, just because you might actually be, like, slipping enough to not know what year it is. Okay? You're like, which also, like, you're in an institution, so hello. But anyway, let's just say you don't know what year it is. That doesn't mean that you don't have the logic skills to understand what a do not resuscitate order means.
Right.
Or you might not understand, or that because you don't know what time it is, you don't know how your body feels.
Right.
Because that's what happens when you test someone's cognitive skills. And they are here, and that means they don't make any decisions anymore. Then everything goes out the window. Like, that information trickles down to the fucking housekeepers in the goddamn facility. Like, nobody even acknowledges you as a human being. A lot of times. Like, you don't get to pick, like, so if you mean to tell me that if you don't know what the date is, you also don't know if you want a grilled cheese or a fucking meatloaf? Because I would argue that people, even in severe stages of dementia, if you offer them, or fuck, God forbid, you actually get off your dead ass and show them something. What if you show somebody a grilled cheese or a meatloaf? You don't think they can make that fucking choice?
Right.
But we take away sweeping
shit, my decision
choices.
might change whether or not I want a grilled cheese or meatloaf, whether or not you put it in front of me.
Right.
You know, based on who's making it.
Exactly, especially
what form it is, if it's pureed or not, for sure. Okay. So, we both wholeheartedly agree that, like, intuitive practice should fully be, like, something that's allowed to be implemented into mainstream healthcare. That's clearly missing. Because I think it's expected that we're all robots once we enter this world.
Right.
And, we've learned we've learned the textbook, we've passed the test, we're told what to do, now go do it.
Right, but it's not that you want to be a robot, it's that you're afraid to not be a robot, because if you don't follow the script and something fucking happens, then your license will be taken away and you'll be
and
brought
especially
in front of a fucking war tribunal.
Well, especially in a society that's very, like, sue happy. You know? But, like, it's not just that. It's like you don't even, like, get the time
444
to be intuitive in most places of practice.
I guess so. Personally, for me, being intuitive takes a lot less time.
No, it does. But I'm just saying, like, I don't think you... I think a lot of people think that they don't... Like, because you're always in this constant, like, rushed mode, right? Like, you got 15 minutes to see a patient. You
I
got to
mean,
get
I
in,
guess
get
that's
out,
true.
see them. Get in, get out, see them. Make sure you do all the 8 million things of documentation to make sure that the codes that you're submitting to the insurance company will get paid out.
Right.
Because if you don't, then you got a pissed off patient now because their insurance didn't cover their visit and they don't know why.
Right. And I guess, like, there is the other piece of it is, like, because I didn't, like, again, when I was working in these settings, it wasn't like, I'm a psychic and these bitches just don't understand me. It was like, something's wrong with me, I don't know what I'm doing, anxiety, 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 which, like, really clouds all of your intuition and your ability to truly listen to yourself.
Oh, for sure. Which is...
So I guess...
Which is a large majority of people working in healthcare are extremely anxious humans.
Right.
Because why not?
Well, how could you not be? Because we as a society fear and shame sickness and death. And then we put all of the sickness and death into buildings all together. Keep all the sickness and death in one pod. Mm-hmm. And then people who choose to care for these people must go there every single day into that energy vortex of sickness and death, which really isn't that big of a fucking deal, except for we attach fear, stress, pain, suffering, all of these heavy feelings, all of these heavy meanings we attach to being sick. So if someone's in the hospital, it's terrible. So then it's like just a heavy cloud of gloom, despair, and agony on top of the sickness and death that's already in the building. And then you are a fucking human being. A human being with a heart that creates an electromagnetic field that is also known as a fucking aura. And your little electromagnetic field is interacting with all of the electromagnetic fields around you. Except for you don't probably know that because no one took the time to even teach you how your body works.
Right.
So now your little fucking bubble is just surrounded by the fear, panic. I mean, fuck. Like, having a baby in a hospital is like the weirdest thing. Like, you have a baby, but everything is still like fucking institutional and serious and angry and kind of sad. Oncology, when I was walking the halls waiting for my cervix to dilate, I was walking with cancer patients hooked up to their IVs because that's who is down the hall. Mm-hmm. Oncology and labor and delivery. Mm-hmm. Holding hands. 2 different IV poles walk in the same halls.
That's a fascinating, though. That's 2 very different spectrums of life, though, you know?
Right.
Bringing one in, letting one go.
For sure. And again, can be totally beautiful. And, like, as I'm saying that out loud, I'm like, how fucking miraculous. Like, to be in oncology and then to be able to go out and wander around and see people excited to have babies is, like, this beautiful experience. Mm-hmm. Except for if you're not looking through that perspective or you're not secure in yourself, you, the one who's having the baby, is like, oh my god, the oppressive gloom, despair, and agony at that end of the hallway. Because most people in oncology aren't happy to be there.
Right, and they're scared.
Right.
Really is what it comes down to.
That's everybody in healthcare is scared.
So what do you do for people now? Now that you're retired?
I heal them instead of try to fix them or bring them to a standard determined acceptable by someone else other than me.
Mm-hmm. Root-based healing?
Yeah, I guess you could call it that. Like one client who got off all of her thyroid medication.
Tell that story.
How long did we work together? 6 months? I think. Was it that long?
No, I don't even think it was that long. I think it was only a couple months.
I don't know. A couple months.
Regardless.
And
she had a lot of underlying chronic health issues. Like
Yeah.
chronic, like long-standing from the time of like a child.
yeah, like inflammation issues, like lupus, informally diagnosed lupus. But anyway,
Recurrent bouts of strep throat.
autoimmune. That's the word I'm looking for. And so, yeah, so she had all of these autoimmune difficulties, which always relate back to inflammation and the body's way of processing and like organizing an immune response. And we worked on healing her energy body. We did a lot of work in like early childhood. So a lot of energetic practices to allow her to get into a meditative state or a certain energetic state so that she could access like repressed memories from her childhood. And then just acknowledging those memories as in with her adult perspective. So something that happened to you when you were a kid but you don't even remember it. Like it happened to you and you made all this meaning from it. You internalized all of this meaning from this one event. And so your whole life you've been operating in this one mindset with this one belief. But now as an adult, if you can pull that memory out and look at it again and you're like, oh, that was just because my mom was a little fucked up, or oh, that was just because my dad you know what I mean?
Right.
Everybody was doing their best and the best wasn't good enough.
And it's something that's becoming more like heard of and talked about in mainstream medicine, but obviously not enough still. But like there's whole premise that like when you have trauma, big T, little t, whatever that be, and certain life experiences, you store them in your body in a certain way, which in the long run can lead to things like chronic illness and inflammation and other underlying diseases that can come out in a physical way.
What I channeled initially that led me to to offering my services to this client was the relationship between the immune system and the heart and its development in childhood. So your thymus gland is located just above your heart. It trains all of your immune cells. So little cells leave your bone marrow, go to your thymus, get trained on how to direct immune responses. Then they are sent to whatever location they're specialized for, and then they direct the immune response in your body for the rest of your life. However, this thymus training process only occurs from the time that you are in utero to the time that you start puberty. And when you start puberty, per Western medicine definitions, the thymus gland stops being an actively functioning organ and shrivels and turns to just fat. So it's just like a fatty deposit in your chest. So all of the immune responses of your body are programmed, trained,
downloaded, ready to go
by the time you hit puberty. And then that is how your body decides to respond for
and
the rest of your life.
And think about all the things that we go that like as kids, like we not oftentimes when we're kids we don't perceive them as like anything that's an issue, but oftentimes like we get to adulthood and we're like, wow, that was a really
and
interesting
trauma doesn't
experience.
mean like there's severe trauma, right? Like you're in the military and you witness someone right next to you being shot and killed and you see them die, and that's like this big glaring traumatic event. But it like trauma is just like, I don't even like to use the word trauma. Like we all just have experiences and we all experience the world and we all have our own perspective. And so like me and each of my siblings has a completely different perspective on our childhood. We come from fucking cupcakey Brady Bunch ass family. Nobody was beating us. Nobody was like coming home drunk or high on drugs. Very cupcakey per all big trauma terms. However, shit my mom did fucked me up. Shit my dad did fucked my brother up. You know, like it's no one intended it that way. We didn't think it was bad while it was happening. It was just like because of who we are, we internalized a certain experience or we internalized what somebody told us in this way that impacts us for the rest of our life. And so we know that all of this happens when we're children, and now we also understand that our entire immune system is being programmed at the same time as well. So while our brain is being programmed for how society works, how we're supposed to behave, think, act, do, now this thymus gland, our higher heart chakra, for the rest of us who are not part of the Western, who are retired from Western medicine, the higher
for those
heart
in the world
chakra,
of spirituality.
So our heart is feeling and experiencing all of these things. Our electromagnetic field is being created by this organ, like a very short distance away from this immune response training that's happening. Sort of boot camp situation for the T's and the B's. That's how I picture them. I picture them with like little like pith helmets on and like crawling underneath those fences in the mud and climbing up over the wall.
That's not how they're depicted in the textbooks, but that would be wonderful if they were.
Thymus gland training.
No,
But so
but
all
they
of this is happening at the same time. So obviously it's influencing each other. And then you have people who have, like, for example, latent strep, like we talked about with this patient. Strep came out for her whenever she was emotionally unsafe. And as we dove back, we uncovered this tumultuous relationship with her mother. And that she truly only felt loved by her mother, taken care of by her mother, once. And that's when she had strep. And her mom took care of her. So now, the thymus gland and the heart have realized at a very young age that the only time your mom is going to show you affection and care for you physically is when strep happens. So they're like, bingo, light bulb, this is the golden ticket. And so then your immune system learns to hold on to strep so that it can throw the strep card back out anytime that you're feeling threatened or overwhelmed or like the body just needs to fucking shut down because you need support. And you're not asking for it because you've been taught to be an autonomous, independent human being, because we also don't know about co-regulation, which is a whole other podcast episode. But so your immune system is a child. And your heart is a child. And then they continue to direct these operations of things that are happening in your body for the rest of your life into adulthood. And so then you get into some crazy shit where your own cells start attacking your cells. Or you have prolonged periods of inflammation, because inflammation is how the body gets what it needs to where it needs to go. You sprain your ankle, swelling. Everything is dilated, so all of the things that the body needs to heal that ankle can go to it. So prolonged inflammation is the body being like, we are unsafe, we are unsafe, we are unsafe. Swell everything up, and maybe we'll find what we need to heal here. But it can't find what it's looking for because you're not actually physically unsafe. You're scared.
I mean, we've even seen, like, like, think about, like, for people who don't, like, understand maybe, like, what the hell we're talking about. Because they're like, I don't understand.
I feel like I gave a very clear explanation.
No, I know, but, like, maybe they've never experienced it before, so they're like, how do I, you know what I mean? But, like, it's the same concept as, like, a stress response that we have, that most of us as adults go through, right? Like, we're stressed out at some point in our life.
Mm-hmm.
We're maxed. What happens when you have long-term chronic stress? You get sick.
Mm-hmm.
And so, not because you were exposed to anything that made you sick, not because something happened, but because your body is like, fuck, I'm done right now. Shutting down.
Mm-hmm.
And, like, forces you almost into the state of rest
Mm-hmm.
and recovery.
Right. I think the difference between what I do now and what I did then is holistic. Because I think a lot of what happens in Western medicine is, like, one, the overemphasis on the mind, the holy fucking miraculous brain that we have that is the greatest thing, the greatest asset of being a human according to Western society. So
I would disagree.
I would disagree too, but I'm just saying that we focus on the mind,
Right.
and then we focus on the body as like this thing that we fix, and we aren't at all looking at the interaction between all of them. That your body might be stepping in, trying to protect your heart, how you feel, your emotions, or your body might be trying to step in to protect your mind because you're so overwhelmed and you're so anxious and you're so up here. So it's trying to draw your attention back down into the body. Mm-hmm. And, like, your body is a whole thing.
Right.
That interacts with your mind and your soul or your spirit. And it's really looking at all of these pieces together and how they work together. And then understanding that each of us is completely individual. There's no way to standardize that.
Right.
Because what you feel in your body is nothing to do with what I feel in my body.
Right.
And we are like polar opposites in terms of that, but we're a great example of that. But also, like, per a standardized test, we would fall in the same window for age range and race and gender. We would fall in the same exact window of any standardized test. But
Christ,
the way
even like lived experiences, you know,
right,
are pretty similar.
But the way that our bodies operate is completely differently.
Right. Right. But that's why too, like, it's just like I don't know how to, like, get people to understand. And by people, I mean those in charge to understand that, like.
But I don't think that's my problem.
No. I'm just saying, but, like, that's one of the areas in which I believe healthcare needs to be redefined, is because it's not this cookie cutter.
Oh, for sure.
Textbook,
I completely agree with that.
Standardized thing. It should be. It's like it should be like so. Like, the fact that, like, you can go to a hospital, right? Like, you get admitted with a certain diagnosis, and, like, there's an order set. Like, there's a standardized order set. Because you experienced a stroke, you should have all this. Because you experienced a heart attack, you should have all this.
Right.
Which should be, like, it should be literally the exact opposite.
Right. But what I'm not disagreeing with that. And because everybody already knows that. Because when I, as a speech pathologist, get an order from the ER that I have to go do a fucking COG exam on someone in the emergency room, which is fucking impossible and dumb. Like, when I see the orders from that order set, then I turn to my fellow SLP comrades in the computer room and are like, can you believe these fucking assholes? They just click on everything in the order set. How could you do a COG test in the ER? And then we all are like, yeah, fuck you, and ignore that order until they get moved to a room where it's quiet enough for me to pretend that a COG assessment is what someone needs 3 minutes after they had a goddamn stroke.
Right.
So everybody, like, there's knowledge of the brokenness of the system already. I just don't think that it's any of anyone's business how to, like, to convince the people in charge. I don't think that's ever the way. I think we change the way in which we operate, and then more and more people are like, oh my god, that makes perfect fucking sense,
right. I mean,
because that's how I operate. That's me, that's me, that's me. And then in that way, it just shifts, because people will understand. There won't be people with chronic illness going to fucking hospitals, because there will be a holistic way for them to be treated. And so maybe the healthcare system can stay the way it is.
Well, and let's talk about the fact that, like, you can just heal yourself as well.
Right, go fucking touch a tree, man. That's what else we need to talk about, by the way.
What?
You might need to cut this out of the episode. But that Healy thing,
Yeah.
that's what it feels like every morning when I plug into my trees. I appreciate the Healy. I appreciate the Germans. I would love to have some little vibey device running around in here cleaning up my messy energy for me.
As you will.
However,
As I will be producing one.
You could also go outside.
Oh, for sure.
Like, that's literally the interaction between us and this planet. That's how it works.
Right, but nobody has time for that.
Right, but I'm saying it's a good...
Because we're all,
Right.
like, running ragged.
Right. I mean,
killing
it takes
ourselves.
10 minutes. 10 minutes of sitting in the grass.
Oh, I know. But most people will say they don't have time.
Mm-hmm. But I'm saying that's why we're leaders. One.
Mm-hmm.
And it's not like I need to present a PowerPoint to an administrator of a hospital to be like, don't you see? We could change everything. I think it just naturally, organically shifts and grows as people come to understand this. And I mean, if the medical system, the way it is right now, was only needed for acute issues, surgery, you know what I mean? Like acute fucking trauma, physical trauma, the healthcare system would be perfect. That's what it's built for. That's what it should do.
Oh, for sure.
So I think that's like in the redefining, like that's what this healthcare system does. Now let's just talk about living, because that's a whole other thing that we as individual humans get to do. And we get to do so in a way that treats our body as a valuable part of our experience, and treats our mind as a valuable part of our experience, and treats our soul as a valuable part of our experience, and acknowledges the energetics of what's happening around us.
Well, and that they're all interwoven.
Right.
Like they're all interact with each other.
Right. But if you think about it through the lens of like what we just spoke on, like huge amounts of chronic illness would be completely alleviated.
Right.
If healing of the type that I'm talking about, the practice that I do, I mean, what was
the result of that?
She's completely off her thyroid medication that she's been on for since the dawn of fucking time. 90 milligrams or some crazy amount of thyroid meds in just a few months. And her thyroid, and they told her she would never be off it. She would be on it for the rest of her life.
Which is most people. I mean, most people, once you go on a thyroid med, because it's an autoimmune disease, the majority of people who have thyroid issues.
And because she was on it, she had to start taking herself off it. Because her body started appropriately producing what it needed to produce. And so she started to feel like she was going to, like, crawl out of her skin. Like, she was, like, ODing on thyroid. Yeah, she started having hyperthyroid symptoms because her body was doing what it was supposed to do, and so then the med was like stacking on top of that, and her body was like, too much.
And mind you, this like took convincing of her doctor to say, like, look, I need you to check my thyroid levels because...
Yeah, and so that's the thing.
Because, like, how do you explain this? I'm, like, doing energy work with somebody, and we work through a lot of stuff, and I feel like I'm hyperthyroid, and I need you to check my thyroid levels because, like, I don't think I need this much medication. And the doctor being like...
No. What ended up happening is that she trusted her... I mean, she also, like... She's pretty adept in energy methods and is very in tune with her body. So because she knew what she was feeling, she started weaning herself off the medication.
Right.
And then she had been off the medication for weeks, at which point her doctor finally consented to the blood test to confirm that her thyroid levels were where they should be.
Right.
And then the doctor came on board. Still didn't believe it. Was like, we're going to check back in 6 weeks because this is some funny shit. But again, so like if we all started healing ourselves in this way, if we all started raising our children in a way that didn't require them to do this level of healing when they get to adulthood to unravel all of this nonsense, then this chronic illness, the way it is right now, does not have to be and just doesn't exist. And it's going to take some time. But I think that's just, like, where we're shifting into. And then, honestly, like, we don't even have to get into bashing the medical system. Because the medical system is not designed for what it's being used for.
Correct.
And that's not its fault.